Hi there. That nurse is 26-year-old Nina Pham, and right now she is in stable condition, and at least one person who was around her when she started showing symptoms is now being monitored.
Nina Pham, just 26 years old and trying to fight off the deadly Ebola virus. The nurse from Fort Worth, Texas, was part of the medical team that tried to save Thomas Eric Duncan, the Liberian man who died last week in Dallas from Ebola. Now Pham's apartment is being decontaminated. Her dog is in isolation inside, with food and water being delivered to the King Charles Spaniel. Pham is the first person to contract Ebola on U.S. soil. A CDC official with direct knowledge of the investigation says the nurse was interviewed several times, and they found inconsistencies in the type of protective gear that she wore and the process used to put it on and remove it. But the case is still being investigated. Experts urge caution in drawing conclusions on whether this was a breach of protocol.
A breach in protocol may be that the protocols find they were not trained properly.
In Boston, a man who traveled to Liberia is being monitored after he complained of headache and body ache. However, the CDC calls him a low risk for Ebola. Meanwhile, in West Africa, which is ground zero for the outbreak, the death toll has now passed 4,000.
I've worked as a public health doctor for 35 years, but I've never encountered a challenge like this one.
CDC officials are going to offer more training to healthcare workers both in Texas and around the country. They are still monitoring 48 people who were exposed to Duncan before he was isolated. Brad?